Good afternoon, everyone, and welcome to this virtual media availability. At this time, I'd like to turn the meeting over to Mecklenburg County Health Director, Dr. Raynard Washington. Dr. Washington.
Thank you. Good afternoon, everybody. Thank you for joining us here for this virtual media update. I'm very happy to be joined by a few of our colleagues and key partners, Dr. Sid Fletcher from Novant, Dr. Jim Hunter from Atrium Health, as well as Dr. Mike Estramonte from StarMed Healthcare. Just wanted to provide an update for the community on a number of key aspects of our COVID-19 conditions and response. As you probably saw from our data release today, we are continuing to experience the impact of the Omicron variant here locally in Mecklenburg County. All of our key indicators are higher than they've ever been at this point. Our case counts are really high. We're seeing several thousand cases per day. Certainly our percent positivity is over 33% for the last week. And we are starting to see a pretty significant increase in the number of folks requiring hospitalization with COVID-19. As many people are aware and know, our testing demand continues to be at really incredibly high levels. That is certainly having an impact on all of our healthcare providers. And I just want to take a moment to just say thank you just to everyone that's in this work with us together, our healthcare systems, our partners at StarMed, all of our testing providers in the community. We are not shielded from the impact of COVID-19, our workforces, our staff members. And so we are feeling the strain and the stress of this current surge. And certainly want to just thank you to everyone who's working on the ground every day to do this work to help our community stay safe and of course protect the most vulnerable in this community. Of course, as I was just saying, we are seeing transmission at levels we have not seen before. We are hopeful that this surge will start to cool off in the next several weeks, but right now we're sort of in the thick of it. I did want to provide a quick update on our sequencing activities in partnership with UNC Charlotte. Our latest report does verify or indicate that roughly 74% of our cases right now are the Omicron variant. This is, of course, something that we're not surprised by. We are expecting that this variant was predominant right now in terms of what's transmitting in our community. And so we would anticipate probably that next week that number will be a little bit higher because these were for samples that were collected about a week and a half ago. And so at this time, we're expecting that Omicron will probably completely be the strain that's circulating right now. A couple of other updates. I'll let our hospitals talk shortly about sort of their operating status. But as I mentioned, they are seeing an increase in utilization. The good news is we're not seeing that same impact in the intensive care units at this time, which is likely related to the fact that we've got a pretty high level of vaccination in our community. And that is a really important part of the equation for us, as well as we have access to treatments in the community. And so we're encouraging folks, one, to make sure you get vaccinated, make sure you get boosted. And if you have a diagnosis and start to feel sick, to seek out testing and treatment. One other update on testing. We are, just a little bit ago, we released a press release. As you all know, we've been waiting for a really large shipment of rapid test kits. That shipment has arrived. Our staff are working right now to unpack and sort and to distribute those test kits so that we can prepare to distribute them to the community. Given the high demand right now we have for testing in the community, we're going to have sort of a mass distribution tomorrow so that people can more quickly access that resource and we can serve more people at 2 large sites versus the smaller sites at the libraries. So we will be tomorrow, Saturday, from 10 to 2 o'clock p.m. at Bojangles Coliseum and at Philip O'Berry Academy of Technology on the west side. We're asking folks to please, you will not be able to come into the testing pickup area until 10 o'clock. So do not arrive early. There is no reason to come at 7 or 6 in the morning. There will not be a line available. There will be law enforcement presence to make sure folks don't start to wait early. Just come at 10 o'clock. We have a large number of test kits available. We're hopeful that we're able to distribute upwards of 20,000 tests tomorrow. So we have some supply, but please don't come early. And in the spirit of safety for our residents in those communities and for the folks coming to get it, to receive test kits, please make sure that you're come in between those hours. If we have to stay a little bit late, we will do that tomorrow, but please don't come early because it certainly creates a safety challenge for us. The last thing I'll say relative to the distribution, we have a lot of folks in our community who are experiencing symptoms that are like COVID-like symptoms, and a lot of folks who've been exposed. So please, if you don't need to take a test right now, please don't come to a testing site or to pick up test kits tomorrow. We really want to reserve these resources for folks who are sick, experiencing symptoms, or absolutely need to utilize take a COVID-19 test. We know the wait times are long and stressful. We ask for folks' patience as we're working as best we can to set up some new sites, potentially even larger sites in the coming days. And so we're doing all we can. And again, I can't thank our partners enough for working alongside us to make testing as widely available as possible. Lastly, of course, I'll close with before I pass it to the hospital staff, with just acknowledging that vaccinations are important. They're critical. The majority of the folks in the hospital are unvaccinated. The majority of folks who are requiring ventilation or intensive care are folks who have yet to be vaccinated. And so we really have got to not distract from that message that we really need folks in our community to do their part and go ahead and come on in and get your vaccination and your boosters on time so that we can continue to do the things that we know are important. So with that, I'll pass it to Dr. Fletcher and then to Dr. Hunter for a quick update on the hospital status, and then we'll open the floor for questions.
Hey, good afternoon, everyone. This is Sid Fletcher. I'm the Chief Clinical Officer with Nolan Health. Appreciate Dr. Washington's remarks. I would just start by saying we certainly, just like last week when we talked, we've got rising numbers in the ED and within the hospital. We are starting to see some more ICU follow through, which is not unexpected, right? We always know that there's a lag time directly related to that. To Dr. Washington's earlier comment, last week when we talked about unvaccinated versus those vaccinated that are hospitalized, we told you that the number was, at least within the Novant system, was around 80% that were unvaccinated that were admitted. We now have actually changed that up to say, hey, what about those that are what we're going to term under-vaccinated, meaning the group that either they've gotten prior J&J, Moderna, or Pfizer, but they're really past the window where they could receive a booster and they have not. So if you actually include them, 96% of the people that are admitted to our facilities are either unvaccinated or under-vaccinated. And currently in the ICU on a ventilator, 100% of those patients fall in that category as well. So what that tells us is really vaccines and boosters work, and it's important for you to hear that message. We continue to use the surge plans that we have had, and I think we're working hard there. We continue still to see a large number of patients that are seeking testing. So, great news from the county that they have these rapid tests and are going to be able to distribute them. We have worked hard at trying to expand our hours of operation as well for testing because, we get it. It's been difficult to try to find that as a resource for testing. I'm hoping that that's going to help, and I guess we'll see what else happens in terms of ability to get those rapid tests over the counter or at local pharmacies as well. Lastly, I would just tell you our teams are really tired, and I think for months we've appreciated the public calling them heroes, but just remember they're moms and dads, brothers and sisters, and they've got family and friends that they care about and that they need to take care of in their environment, and they can get sick just like everybody else. So what I would say is we've been asking for a long time. We know that telling you to get a vaccine doesn't work. So I'm going to just say we're begging you, please get vaccinated if you have not been vaccinated. It's critical. We need you to do that. If you're eligible for a booster, please get a booster because our teams have loved you calling them heroes, but they're tired and they really need some relief. And with that, I'll turn it over to Dr. Hunter. Thanks.
Great, thank you very much. I'm Jim Hunter. I'm the Chief Medical Officer for the Atrium Health Enterprise. First, our numbers are rising just as everyone else's is. Our staff is also experiencing increased illness with the Omicron variant, we presume for most of that. And so those numbers are up. Our message from Atrium Health is that we're going to get through this. We're better prepared than we were 2 years ago by a vast amount. We have a federally approved, safe and effective vaccine, boosters. We have medications. We know more about how this spreads and how to treat it. And even with the challenges that we have with the increased numbers and illnesses of the staff, we've got an incredible set of teammates here. We've got over 70,000 teammates at Atrium Health. Their resilience has been impressive over the past 2 years. And we have plans, and we are executing on those plans to make sure that we can care for the sick people that need it in our community and do it in a safe, efficient, and high quality way. So last thing is, again, I will also echo the vaccines. The vaccines are important. The boosters are important. Please do that. Please do not come to the emergency departments for tests or for non-serious illnesses. There are lots of other options out there to have your needs met. So with that, I'll pause, and Dr. Washington, turn it back to you.
Thank you. And let me just also sort of echo the begging. We are begging at this point. We need folks to get vaccinated so that our hospitals can continue to serve those in our community that have urgent health issues, folks who car accidents, any other kind of injury or heart attacks or strokes. We need the space and the healthcare resources to do that. And so we're asking folks to do their part and help us. We are a community, and I also echo the sentiment that we will get through this surge. We are prepared, as prepared as possible. The last thing I'll say is for folks who are in the long testing lines, our partners across the county at the healthcare systems at StarMed are working to increase capacity as much as possible. So we're asking people to be patient. We are looking at a number of alternative sites that we're hoping to be able to either relocate some sites or expand capacity at new sites to be able to deal with some of the traffic issues. But remember, these folks are doing their jobs to help serve us as a community. So please be patient, please be kind. We are a community. We all have a role to play here. And so just asking folks to help us in that as we work to mobilize additional resources as quickly as possible.